Hi, I'm Brian McMaster and this is spinal flossing. Let's start out with our spinal flossing exercises. Reach up as high as you can. Continue to reach up, side bend one time either way, rotate one time either way. Come back to the center, reach up and lean back, come forward and squat. And then step to the side, turn your foot in, rotate your body in the opposite direction, step back, step and turn your foot out, rotate your body in the opposite direction. Foot turned in, body goes in the opposite direction, foot turned out, body goes in the opposite direction. So today I want to dig into the squat a little bit more and work on this junction area between your upper back and your core. So things that help us, and this isn't the perfect squat, there's a lot of little details to it, but major things that you want to pay attention to when you're doing a squat to keep your body centered is flexibility in your legs, especially the calf, flexibility in the thigh, especially the quadricep, glutes, core control, but also the rigidity or mobility in the upper back. And we're going to talk about how to get to that today. So when you're squatting down, pull the shoulder blades down in the back. That usually flares your ribs up. Tighten your stomach and pull your ribs down, tightening your stomach, pulling between the front of the pelvis and the front of the ribs. Then you're going to bring your hips back, continuing to keep a balance between the back and front, pulling the shoulders down in the back, ribs down in the front, keep the knees behind the toes, and see how far you can control coming down. One of the things that limits our ability to squat all the way down and keep your body upright is this upper back rigidity. So today I want you to challenge that area a little bit differently. I still want you to do the spinal flossing because that gets some mobility into this area. Foam rollering we've talked about in the past to give a deep mobility. This is more of a strengthening move for that area. Shoulder girdle, upper back, rib cage, upper part of the core. So start out with a low chair, high chair, feet are straight. You're going to squat down and control your squat, shoulders down in the back, ribs down in the front, knees slightly inside the ankles so you feel the inner thighs working. And then push both hands down on the seat of the chair. And then continue to push down with one hand and reach up and back with the other. That reaching up is going to require that you reach up as high as you can, but then pull the shoulder blade down in the back, flaring the ribs on that side. You want to tighten that stomach a little bit more. And then to give you a little bit more control, squeeze the knees in a little bit more so you're connecting upper body and lower body together through the core. And then go back and forth a few times. And it's challenging initially because we don't usually isolate this area, but it helps us build a strength in that area, increase our awareness, and then once you get up after mobilizing that area or activating that area, then you mobilize it with the overhead reach, the foam roller exercises. Helps you gain better control over here. That can shift you from here to here, make you a little more upright, have it easier for you, more automatic to turn on your abdominal muscles with every stride, and help activate the core with your daily activities. A lot of information there. What I would encourage you to do is just play with that and see if you can notice a difference over the course of 3 or 4 weeks. I'm Brian McMaster. This is Spinal Flossing. I'll see you guys tomorrow.